I'm McKenna. I'm going to be your nurse today. Wash hands, provide privacy, just to let you know that everything that you say and will show will be confidential due to HIPAA bylaws. Can you tell me your name and your birthday?
Jamila Mayberry, 12/28/77.
And that is correct. Well, Miss Jamila, I will be doing a head to toe physical assessment on you. Is that okay?
Yes.
Alright, I have got consent. Okay, so as I'm looking at her, I'm inspecting her face, seeing that that is symmetrical. See any cuts, bruises, redness, edema, no discoloration. I'm going to check her scalp for any lacerations, abrasions. Do you feel any pain or tenderness when I palpate your head?
No.
Okay, now I'm going to check her TMJ. Can you open your mouth for me? Can you close? I didn't feel any clicking. I'm going to check her temporal artery. Alright, good. Now I'm going to do cranial nerve 5. Can you clench your teeth for me? Alright, hold against resistance. Alright, that's good. Okay, now can you smile for me? Brown. Can you close your eyes? Can you lift your eyebrows? Can you pull out your cheeks? Okay, good. Alright. Now we're going to do cranial nerve 2, which is visual acuity. We're going to do the smelling shot. Do it 10 feet. Okay. Do you wear glasses or contacts?
No.
Okay. Can you read the line that you can see clearly?
Yes. EDFCZP.
Good. Okay. She made it to line 6, which is 20/30 at 10 feet. That will be documented. Alright, sit down. Okay. I will check her cartilla, which I will check to see her pupils, make sure they're equal, round, reactive to light, and I'll also be checking accommodations with the 6 fields. Alright. Jamie? Alright. They are round and reactive to light. They are about a 5. About a 5. Okay? I need you to watch my pen light without moving your head, okay? Alright, good. As I'm looking at her, I'm looking at her eyes. I'm looking at her sclera, which is bright. I'm looking at her conjunctiva, make sure that they're pink and moist, which they are. I'm looking at her iris and her corneas to make sure that there is no drainage, discoloration. And then I will be checking her eyelids, her eyebrows, lashes has equal distribution, and yeah, okay. Okay, so now I'll be inspecting her external ears. Alright. They are symmetrical. I don't see any redness or swelling, any type of drainage. Alright, so I'm going to be arms linked away from her and do a whisper test. Alright, you'll occlude that ear. And I will say one word and hopefully she can repeat me. Okay. Good job. Good job. Okay. Okay, so now I'll do the nose. I'm looking at it, I'm seeing swelling. Her septum is midline. Alright, can you occlude one nostril for me? Sniff. Can you do the other one? Sniff. Alright, good job. Then I will check her maxillary and frontal sinuses. Do you feel any pain or tenderness?
No.
Alright, any pain or tenderness when I palpate your nose?
No.
Alright, good job. Then I will put in her nose. I don't see any drainage, any redness. Yep. Now I will check her mouth. I'll use a pen light to inspect her mucosa, tongue, gums, teeth, Open it for me. Alright, her tonsils are gone.
Yep.
Absent. Alright. And now check. Yep, I saw your teeth. I see your tongue. Alright, tongue is stuck out and it is symmetrical. No redness or dry. It's moist and pink. Alright, can you open your mouth for me, please? Alright, can you say Alright, her uvula did rise. I will now test her gag reflex. I will be using a straw. Open up. Okay, good job. You're doing great, Miss Chanel. You're welcome. Alright. Okay, so now I will check her neck. I'm going to now palpate her lymph nodes. I should not be able to feel any of them. If I were, that means there's some type of infection or inflammation. Do you feel any pain or tenderness as I?
No.
No? Alright. Now I'm going to, now can you put your chin to your chest? Alright, bring it up. Alright. Can you do your ear to your shoulder? The other side? Alright, can you turn your head for me? Alright, other way. Alright. You'll turn this way against resistance, please. Push against my hand. Alright, good. This way. Alright, good. Okay. Then I'm going to palpate her trachea and check her thyroid. I will ask her to sip some water. And I will get behind her. See, her trachea is midline. Wait! Okay, so. Okay, I did feel a rise and fall. I do feel it to be movable. Do you feel any pain or tenderness?
No.
Alright. You keep it. Okay. I will now check her carotid pulses. Of course, one at a time. Don't want to occlude any type of circulation. Alright, +2. And I will auscultate for bruise. I'll be using my bell. Alright, there were no bruises or twishes noted. Okay, now we'll check the posterior of your chest. Will you please? No, it's the back. So I guess you turn around like this for sure. Yep. Yep. Alright, do notice some design noted. Okay, so posterior of her back is symmetrical. I don't see any lesions, no this type of abnormal discoloration. I will. Do you feel any pain or tenderness when I do this?
No.
Alright. Can you say 99 for me?
99.
Alright, again.
99.
Alright.
99.
Alright, I did feel vibrations as I was tactile from my mucus. Yep. In symmetrical expansion. I will now listen to her lungs. Alright. You gonna breathe in for me? Alright. Alright. breath sounds are normal. And I will check her flank for any type of tenderness. Alright. Do you feel any tenderness as I do this?
No.
Alright. And then I'll scale for breath sounds. Alright, now we'll check her upper extremities. You can lower your shirt down. And then sit down. Alright, I will inspect both of her arms. Do you feel any pain or tenderness or feeling your arms?
Mm-mm.
No? Okay, I'll check her brachial arteries. Alright, now I'll check her radial. And I'll check her arm. Alright, all pulses are present, +2. Alright, will you lift your arms up all the way up here for me? Okay, now will you do it all the way in the back for me? Alright. She hyperextended, was able to flex. Alright, can I, your hand, I'm gonna do capillary refill. Okay, capillary refill is +2. Alright, can you, now I'm going to check her elbows. Alright, can you bend your elbows for me? Alright, can you, thank you. Now I'm going to do her wrist. Can you, alright, can you fist? Okay, spread them. Alright, can you do, touch your fingers to your thumb? Okay, good. Alright, can you put my hands against your wrist? Alright, back. There you go. Alright, I'm going to grab the side. Yeah. Close your eyes, and I'm going to write a number in your hand. And you have to tell me what number it is, okay?
Mm-hmm.
Alright.
0.
Yes. Then I'm going to place an object in your hand, and you're going to close your eyes for me and try to guess what it is.
A pen.
Yes. Alright, open your eyes now. Alright, now I'm going to check her chest anteriorly. You can push it up for me, please. This time I'll be focusing more on her heart since we did listen to her breath sounds posteriorly. Alright, as we can see, that as she breathes, it is symmetrical. It's a good rise and fall. Unlabored. No lesions, no abrasions, no type of discoloration, no swelling. I'm now going to listen to her heart. Make sure that's diaphragm. Alright, listen to S1 and S2. The adventitious heart sounds noted. And I'm going to now listen to it with the bill. Listen for any bruise or thrills. Now I'm going to test her abdomen. Will you lay down for me? I will make sure to inspect, auscultate, percuss, and then palpate. First, I'm going to inspect her stomach. As you can see that it is flat. No contours. I don't see any type of nodules present. I don't see any pulsations. So as I'm inspecting it, I will now auscultate it. I will listen to the right lower quadrant first. Usually you will listen to it for 1 minute in each quadrant, but for the sake of the video, I'll do it for 5 seconds. As I'm listening, I'm also being mindful of the anatomy that I'm listening to. Alright, now I will percuss. I will be looking with silence to vibrations. And I'll do a deeper percussion. Trying to feel for that vibration. Alright, now palpate. Are you feeling any pain or tenderness while doing it?
No.
Okay, good. And while I'm here, I'm going to go ahead and I'll palpate the liver. I don't feel any type of protrusion or any type of enlargement. I'm now going to listen to her renal arteries and her aorta, which are below the umbilicus. I shouldn't be able to hear any bruise or thrills. Then I'll be listening to her aorta, which is above her belly button. Alright. You can lower your shirt now. Okay, so now I'm going to inspect her lower extremities. I'm gonna do that. I feel well. No, you should lay down. It's just your pain. I have to inspect your skin and stuff. Thank you. Alright, so as you can see, there's no type of discoloration, no swelling, no edema. I'm going to now palpate her pulses, her popliteal, her dorsalis pedis, and her tibial pulses. Get y'all a little bit hard. Alright, I will now check her range of motion. Okay, will you? Okay, will you now lift your leg up at a 90-degree angle for me? Alright, now the other one. Alright, good. Can you do your knee into your chest? Okay, good. Alright, can you now use your heel and then rise it up and down your shin for me? Alright, can you do that for me? Alright, good. Okay. Can you lift your feet up for me? No. Like you feel like you're push down for me like you're driving a car. Right now, push feet up. Alright, good. Now, can you do it against resistance? Alright, good. Now do it up towards resistance. Alright. You'll lift your leg this way. You'll abduct your legs, please. Alright, and abduct. Alright, good. Okay, so now you'll stand for me. Okay, can you walk on your heels? Alright, can you walk on your tippy toes? Alright, close your eyes and stand for me. Alright, little swaying is noted, but that's good, normal. Alright, can you hop on one leg for me, on your right leg? Alright, hop on your left. Alright, so now I'm going to check her spine. As you can see, it is symmetrical and it is midline. Alright, can you bend forward for me and touch your toes? Alright, can you bend backwards for me? Alright, good. Can you bend side to side for me? Alright, good. Okay. So, you can sit down for me, Miss Mayberry. That was her physical assessment. I am now going to do her patient teaching. As far as family history goes, the only issue that I found with Miss Jamila is her insomnia. So this is her patient teaching packet. Here you go. Right. This is pretty much they informing her what insomnia is and how insomnia is a well-known sleeping disorder that can either cause a patient to wake up too early or to not get enough sleep or have trouble falling back to sleep. Usually if they were to have been woken up, that's very difficult for them to try to fall back to sleep. Or they can cause them to wake up too early, like before their alarms. There are different types of insomnia. They have short-term insomnia, which can sometimes only last a couple of days to about a few weeks. And that's usually caused by like a stressful event, like a death in the family or like bills, responsibilities. Then you also have long-term insomnia, which can last up to 3 months or longer. And then according to the CDC, females, I did specifically this one for females because she is a female, because she's not getting enough sleep. According to the CDC, there was an increase in 4% of women who are not able to get enough sleep from the years 2013 to 2022. A lot of the risk factors found in women that have insomnia is stress, concern about work, family, marriage, their health, poor sleeping habits, like maybe not sleeping in a comfortable environment. In this situation, she does have a little toddler that sleeps with her as well, and waking up at different times of the night and then taking naps. Anxiety and PTSD can also be called mental health factors, can be a risk factor as well. Drinking caffeine. Miss Jamila here is a nurse, and so she does drink caffeine throughout the day. And then as far as alcohol goes, it can help people go to sleep, but then it can also cause them to have difficulty getting to that deeper level of sleep. I did say that women are at higher risk for having difficulty with sleeping because of their hormone changes, like with menopause and with menstrual cycles. And then you can also have irregular schedules, like changing in your shift. Like for example, Miss Jamila works a 12-hour shift at one job and 8-hour shift at another. So that can cause her schedule to be completely different and can affect her sleep-wake cycle. A lot of the signs and symptoms with insomnia is difficulty falling asleep, waking up throughout the night, waking up too early, having fatigue during the day, because she having all these symptoms. Depressed, irritability, anxiousness, difficulty paying attention or focusing in situations, and then having increase in errors or accidents. Ways to prevent ways to prevent insomnia is having a regular sleep-wake schedule, even on the weekends. So even on the weekends, just go to sleep at a certain time, wake up at a certain time, and then just try to keep that at a consistent level. Try to stay active. Going to the gym can help with going to sleep. Limit naps. If you sleep throughout the day, that can affect how you sleep or how long you sleep throughout the night. Trying to limit your caffeine, alcohol, and nicotine intake. Try not to drink large meals or try not to eat large meals or to drink a large amount of fluids before bed because you could get up with stomach discomfort or have to go to urinate. And then also having a comfortable sleep environment, like, you know, putting a little toddler in his own room. Some treatments that help with insomnia is cognitive behavior therapy, which helps control or stop completely negative thoughts. Medications like antihistamines like Benadryl, even though it's for allergic reactions, it also does help with sleep. Your benzodiazepines, and then melatonin, of course, which is a natural supplement that you can take to help sleep. You can address the underlying health conditions or underlying causes of what's causing the patient to not be able to sleep. Alternative therapies like acupuncture, meditation, and aromatherapy. And then you can also have sleep studies that can also help figure out what's causing the insomnia and to help relieve the issue.